What if you had a dangerous blood clot in your legs or in your lungs and you couldn't be treated with the normal anticoagulation or blood thinners? What would you do? Luckily, we do have a medical device called an IVC filter that can prevent blood clots from traveling to the lungs. But if you or somebody that you know have been recommended an IVC filter, you probably have questions about it. Why is it needed? What should you expect? Does the filter needs to be removed? In this video, we're going to be talking about everything that you need to know, and I will break it down for you. Let's get started. Why an IVC filter might be necessary? When you develop blood clots, especially in the legs or pelvis, known as deep venous thrombosis or simply DVT, it can sometimes travel to the lungs, causing a serious condition called pulmonary emboli, which can be life-threatening. But these clots can usually be treated with blood thinners, and the blood thinners are very effective in preventing problems related to the blood clots. Sometimes they may not completely dissolve the blood clots, and you may need to have the blood clots removed. But at least most patients that are on blood thinners, they will not develop significant pulmonary emboli. However, there are cases that the blood thinners are not safe or effective, and an IVC filter can provide an extra layer of protection by catching big blood clots before they can reach the lungs. So what exactly is an IVC filter? C stands for Inferior Vena Cava, which is the larger vein in your body and is located in your abdomen. So you have the iliac veins, which are the large veins that are coming from each leg, and they join together to form the inferior vena cava. Inferior vena cava is a big vein. It measures anywhere from 2 to 3 centimeters and carries the blood flow from the abdomen and both lower extremities back to the heart. The IVC filter is a small metallic device, and most of them look like one of those little umbrellas that they serve with drinks in Hawaii. But they're made of a special metal called nitinol, which is an alloy of nickel and titanium. And it's a metal that was initially developed for space travel, actually. What this metal does is it can be compressed to a very small size and placed through a small straw. And then when you push it out of the straw, then it assumes whatever shape you want. In this case, it will be the shape of one of those little umbrellas. When this filter is placed in the right location, it is able to trap blood clots while allowing the blood flow to continue to go through the veins normally. It certainly can be life-saving by preventing big clots from traveling to the lungs and blocking the entire circulation. Nowadays, all the filters are designed to be removed, and they are called retrievable filters. And what you can do is you can put a little tube through the vein, and using a snare, you can grab this hook and then remove the filter through the little tube without needing any cuts or scars. And it's actually very easy. And we will be talking more about this in this video. So who might need an IVC filter? There are several situations that a filter may be necessary. The most common scenario is what we already talked about, and is when you have a blood clot in the legs or in the pelvis, and for some reason you cannot take the blood thinners. For example, let's say you had recent surgery, or you have an ongoing gastrointestinal bleeding or an intracranial bleeding, then you cannot take blood thinners. So if you develop clots, you will need a filter. And in those situations, you probably won't be able to take the blood thinners for a while. Another scenario that filters may be necessary is when you are on blood thinners, but you are still developing new clots. And sometimes we don't know exactly why. But in those cases, it is a good idea to place a filter, at least until things are more stable. And there is one more situation that filters may be necessary. Let's say you have a patient that has been laying in bed for a long time, so they are at very high risk for developing blood clots. And in those situations, usually we use a blood thinner just to prevent blood clots. But let's say they had recent severe trauma, or they had a spine surgery and they are super sick and they cannot have any blood thinners. In those cases, you may consider putting a filter to prevent pulmonary emboli during this period, since pulmonary emboli is one of the biggest causes of death in those patients. And we do so knowing that we can remove these filters once the patient is back to normal and walking around. Now let's talk about how the procedure is done. An IVC filter is usually placed by an interventional radiologist like me using minimally invasive techniques. It feels like putting one of those ships in a bottle, but it's actually really simple. It's a quick procedure that usually takes me under 5 minutes to do. You start by using ultrasound to place a small IV in the vein in the groin or in the neck. Most of the time I do in the groin just because it's more comfortable for the patient. Then using X-ray imaging guidance, we position the filter in the inferior vena cava where we want, and we simply deploy it. As I mentioned before, these filters come collapsed and can be inserted through a very small, thin tube. And when we're in the right position, we can just push them out of the tube and they will assume their normal shape. It is one of the simplest procedures we do, and if everything goes well, we should not have any pain after the procedure and essentially should feel normal right away. But like any other procedure, there are obviously risks associated with the IVC filters. The most infamous risk is a risk of filter migration. You see, the legs of the filter usually have little hooks that maintain the filter in place. Migration means that you put the filter in one place and then with the activity, you would move to a different place. The worst case scenario would be moving to the lung. But although this is a potential risk and have been described in the past, quite frankly, with the new filters, I have not seen this happening. I have seen with older filters, but not with the new ones. Now, what we can see with some types of filter is that they can tilt. They stay in place, but they tilt a little bit, and that can make it more difficult to remove them. By the way, if you're curious, in our practice, we use the BD Denali filter. I have been using these filters for over a decade, and as far as I can remember, I was able to essentially remove all of them, and I never seen any problems with migration. The last risk that I will mention is actually the most important one because we see that every once in a while. You can imagine if the filter grabs a large clot, this could lead to the entire vein to clot. If this happens, the patient can have severe swelling of one or both legs. This can be pretty cumbersome. But the good news is nowadays we have a lot of devices that can remove these clots very easily and successfully. And this is actually one of my specialties, and I will be talking about in a different video. In most patients, the filter is just a temporary solution for a short period of time, and once the patient recovers and is back to normal and tolerating blood thinners, the filter usually can be removed. There are exceptions. Let's say a patient has a terminal cancer with brain metastases, they're very high risk of bleeding. Those patients are probably keeping the filter forever. But in practice, we essentially remove almost all the filters we place. So that's why if you had a filter placed, you should always follow up with us in a few weeks so we can make a decision of if and when the filter should be removed. Now, the filter removal is a very simple procedure as well, although it's one more appointment. I know everybody's busy. But as far as procedures go, it's a 5 to 10 minute procedure. Like I mentioned before, we insert a little tube in the vein, usually from the neck, just because usually the hook is on the top of these filters. And through this little tube, we then insert a snare that we use to grab the hook of the filter, and then the filter collapses again and can be easily removed. We don't usually stop the blood thinners to remove the filters, so patients can continue to be on the blood thinners, and patients can essentially resume normal activity by the next day, even playing sports or going to the gym. In summary, an IVC filter is a safe and effective way to protect against the life-threatening blood clots when other treatments may not be enough. As always, if you have questions, feel free to reach out.